We have some 400 million people worldwide that already have diabetes, and the numbers are not going to get any better. We know the obesity epidemic is just continuing, and indeed it is spreading. Now, we know diabetes increases risk. What can we do to prevent it? The topic that we're talking about is not one you might necessarily think of in the world of prevention for diabetes. The idea is high blood pressure. And the title for this October 6th issue of JACC paper, Usual Blood Pressure and Risk of New Onset Diabetes, Evidence from 4.1 million adults and a meta-analysis of prospective studies. You did a lot of work on this paper. This is Dr. Kazem Rahimi, who is Associate Professor of Cardiovascular Medicine at the University of Oxford and also Deputy Director for the George Institute for Global Health. This was quite an undertaking. First off, why did you do it?
We are interested in blood pressure, common causes of common diseases, and diabetes. And as you have just said in your introduction, this is a big public health problem. And we had the opportunity of looking at it in a much better and rigorous way than has been done before.
And we're used to talking about hypertension and damage to the heart and to the muscles, but we don't necessarily link hypertension into this mix. So what did you find?
So what we found is that elevated blood pressure is not just hypertension. I mean, the lower, the higher, the higher the blood pressure, the higher is the risk of people developing diabetes. And what we found on an average, that increases the risk by about 60%.
Wow. So you did a cohort analysis first.
Yes.
And who were those people?
So these were people who were registered with their own doctors, the general practitioners in the UK. As you just mentioned, over 4 million people. We excluded everyone who was known to have vascular disease at the beginning or known to have diabetes at the beginning. So we were left with a cohort of people who were free of vascular disease but had their blood pressure measured. And what we analyzed following these people for many years looked at how the baseline level of blood pressure is associated with people developing diabetes over time.
And what you found is there's actually no nadir in the normotensive range.
Exactly, and this is consistent with what we know generally about the blood pressure, that there is no threshold beyond which people start developing heart attack. This is a continuum, and it starts at much lower ranges that we as clinicians consider to be abnormal for the risk to increase. And in fact, in the middle range, it was where we saw the steepest incline in risk of diabetes. It was some suggestion of a plateau, but that was in the range of 110 millimeter mercury, and there were too few people to make any robust conclusions at that range.
I'm usually about 116 over 74. So I'm not 120 over 80. If I were 120 over 80, would my risk actually be a little higher than it is right now?
Exactly. That's what the data shows. I mean, with your blood pressure, you're in the range.
The lower the better.
Exactly, yeah.
Now, in terms of this, you talked about the cohort a little bit. Then you also did a meta-analysis of 30 studies.
Yeah.
You have no spare time, obviously, at all. What did you find here?
I mean, I have to say that was done by my colleagues and myself. It's not that I did it all myself. So one of the key criticisms of using electronic health records for doing that type of analysis is that there may be some bias in it. And being mindful that this may come up, we in fact looked at what have other people done using cohort studies, investigating the same question. What we knew from the onset that these studies have been much too small to be able to be conclusive. But by gathering those 30 studies together, what we found that the overall effect was consistent with what we found in investigation of 4 million adults.
So you feel confident of your data at this point?
Yes, I think there's little doubt that there is an increased risk of elevated blood pressure being associated with diabetes based on the totality of evidence that we have gathered.
So what all this suggests to me is that individual and population-based efforts to lower blood pressure may also as well lower the incidence of diabetes.
Yes, so that's the conclusion that we're making, and as you just said, may. Because of the observational nature of the data, one cannot be certain that this is a causal association. And what we discuss in the paper is, in order to show that it actually reduces the risk of diabetes, randomized trials are needed to see what impact that it has. And we have seen a number of randomized trials which have had some conflicting results. We know that ACE inhibitors and ARBs tend to reduce that risk, but what happens with diuretics, beta blockers, and so on, it is less clear whether this is off-target effect of those treatments compared to ACE inhibitors is something that needs to be investigated, and we are looking at pooled evidence of randomized trials as next to investigate it in more detail.
I mean, clinicians should be looking at blood pressure no matter what, but this does kind of give us even more impetus to say we really have to concentrate on this and get blood pressure down as low as we can.
Exactly. Focusing on risk is the message of this instead of focusing at one threshold of blood pressure that we traditionally learn in the medical school to focus on.
Right. Well, congratulations, because this was quite a study and quite an undertaking you have here. And it is in the October 6th issue of JACC. Please look for that and a variety of other papers. And from ESC, I am Rick McGuire, the executive editor of Cardiosource World News.